So today I'm going to explain you all. I'm going to show you all inside the ICU how a cardiac monitor looks like and what are the things we can monitor in the cardiac monitor.
So this is how a cardiac monitor looks like. So this patient, he is connected to the ventilator as well as to the cardiac monitor. So if we zoom it, we see that there are various parameters which we can monitor through this cardiac monitor. So the first one is the ECG. So this ECG lead, it is connected to the patient's chest. It is a 5-lead ECG. So here lead 1 and lead 2, we can see any kind of changes in the electrical activity, and we can also assess the heart rate, which is 105. We can also check the respiratory rate. It is 32 beats per minute for this patient. This is also detected with the help of the ECG lead, which is connected to the patient's chest. Again, here we can detect the SpO2 level with the help of the pulse oximeter, which is connected to the patient's finger. And this is this yellow color line you see here. So this is the plethysmograph, which detect any kind of the changes in the blood volume in the patient's peripheries where the SpO2 probe is being connected. And here you can see we can also check the EtCO2 level, that is 22 mmHg. Normal EtCO2 is between 35 to 45 mmHg. These are the probes. So the first one is the ECG probe, the 5-lead ECG, which is connected to the patient's chest. Second one is the SpO2 probe. Then we can see the NIBP. So the third one is the NIBP, which is connected to the patient, through which we can check the non-invasive BP. So the last here you can see this is the EtCO2 probe, which is connected to the monitor, and to the patient it is connected to the ET tube, it is being connected. So normally this EtCO2 level, it is between 35 to 45, but for this patient it is 22 mmHg, which is less. To summarize, this is a cardiac monitor through which we can assess various vital parameters of the patient who is connected to the ventilator or the patient who is on ICU. We can monitor various parameters. So we can check the ECG with the help of the 5-lead ECG, which is connected to the patient's chest. Through this we can also check the heart rate as well as the respiratory rate can be detected. We can also connect the temperature probe, through which we can check the temperature in the cardiac monitor itself. We can check the NIBP, non-invasive BP, which is connected. I've already shown you the probe. We can also check the invasive BP with the help of the arterial line. We can also monitor the invasive BP. We can also check the EtCO2 level as well as the SpO2 level can also be monitored. So these are some of the parameters which we can check through this cardiac monitor. I hope this video was quite helpful for everyone. Thank you.